Planning Committee meeting. We do have a quorum, and so we're going to get started. I do not anticipate us being here a long time today. And just for the record, my son has his first seventh grade football game at 5:30 this
Right.
afternoon, and I plan on being there.
Okay, well, let's,
Mr. Chairman, you're going to have to step up.
Well, you need to move on then, is what I need to say, Mr. Parity.
All right, so I'm
not, he's
informed
going
of
down to
no
the vice
citizens
chair.
wishing to appear before the committee, so we will move straight into our matters of deliberation. I'd like to get a motion on our minutes from the July 18th meeting, if I could, please.
Move for acceptance.
Motion from Dr. Weber, second from Mr. Powell. Any question or discussion? All in favor say aye.
Aye.
All opposed, same sign. That motion carries. Thank you.
Okay.
Angie, where are you at? Hello there. Come on up. While you're walking up, let me give you all kind of an overview of the agenda today, and Ralph's not back in here, but I'm sure he will be directly. We're going to go through our typical capital project report and get Angie to keep us updated on that. The second item on the agenda was requested that we add this item. We're going to have a discussion about the prioritization process in the bond package, and specifically, I've asked staff to walk us through exactly where we are in reference to existing contracts and where we plan to be in terms of future discussions relative to the board's decision and the board's recommendation on priorities. And I want to keep that as a kind of a global discussion. I think most of you are aware we are having a joint board meeting with the County Commissioners Court on the 17th, and I'm confident this topic will be deliberated extensively during that meeting.
And Mr. Chairman, it's my understanding that is a posted joint meeting. It will be also a public meeting for,
Good. So, anything that we do here today, I think we're just going to consider supplemental information, make sure that we've got the right understanding from staff about the process and where we are now. But relative to any action items, I think we'll just we'll defer that until after we've had our meeting on the 17th. And if the chairman directs us to meet again beyond that, then we will do so.
Okay.
So, Angie, welcome. If you'll walk us through the capital projects, we'd appreciate it.
Got on green. Okay, so for our first one, our ED expansion into the shell space over on the pavilion, the east side of the street, we are excited that that's going to open on schedule on October 1st. That gives us 12 new treatment rooms, and we've got 14 chairs in there, so about 26 spaces, so that's really exciting for our ED. The radiology equipment project, that was lots of general x-rays, and our last thing was that third MRI, so we're on track to get that finished. We're confirming with the state that they're going to come do their final inspection on or around October 7th, and so we'll open shortly after that. And our last one is the evergreen, never-ending behavioral health environmental safety project. So we're still in the midst of that. Our two biggest pieces that are left are the Trinity Springs dining area and the courtyard. So originally, we didn't think we were going to have to do anything to those, but they've come back and said, yeah, ligature resistant, even though they're somebody, staff's there all the time, we're still going to have to do that. So we're looking at getting that finished this year.
Does that push our schedule?
Oh, it does.
A little
It does
bit.
push it, because we didn't originally intend to do that, because the state was accepting mitigation plans originally, and those are always staffed.
Sure.
And that was our mitigation plan, but now we're going to have to go ahead and go in there and do some work.
Okay. How much you think it pushes it schedule-wise?
Oh, at least probably a good 6 to 9 months.
Oh, wow.
Yeah.
Okay.
I mean, it just is. There's,
Yeah.
if you look at the courtyard, there's lots of trees,
Sure.
there's a wrought iron fence,
Sure.
there's just a lot of things we're gonna have to take care of out there.
Okay.
And in the dining room, it's mostly the tray line that goes through there.
Is it just state stuff that we're having to permit and worry about? Are we pretty good on entitlements regarding the city and all that?
Everything else is fine.
Okay,
We have good luck with the city, no
good.
problems at all.
Yeah, they are great helpers to us. We appreciate that very much. Okay, anything else on capital
No, that's my
project?
3 capital projects going on right now.
Roger?
The radiology equipment construction is about 40 grand over budget. Did we know about that, and what is it?
Let me look at that. You know what, on that particular project, we got a deductive change order from our contractor. It was around 52,000, so that's gonna come back down.
Oh, okay, all right,
So
thank you.
thank you for recognizing that and asking.
That's a true city council member right there. Good answer too, by the way. That's
Yes.
good news, good news. All right, any other questions for Angie? All right, good. So let's, and Reverend Emerson, you were away when we started, but I've kind of encapsulated this in a way to frame it, we, as you know, have a joint county commissioners board meeting on the 17th. This is basically the agenda topic for that as well. You had asked at our last board meeting to revisit this item on the planning committee, so we put this on today to do that. I've tried to get the staff sort of prepared to make sure that the planning committee understands the process that we have been through to date relative to anything that would be bond, affiliated. And also make sure that we understand process.
Right.
Because I think there may be some miscommunication about some of the process relative to who we've retained, what their scope is, what we still have to do with regard to competitive bidding and all that. So I want to first give you the floor and let you frame your questions and observations however you want, so that we don't miss something today, but, and that goes for everybody else as well. But then following that, I'd like to get staff's sort of response to it, and we can kind of have a discussion and walk through that in a manner that hopefully clears it up for us.
Well, first thing is that I'm the one who made the motion to go forward with the 2 medical homes.
Sure.
Okay. But after that, I got a lot of questions about, hey, are we handpicking who we are going to do the plans, who are going to do the construction? How do we determine that we're going to do 2 medical homes when we talked about behavioral health and we talked about the patient tower? So it made me come back and say, whoa, I mean, because I kept getting a lot of questions on that.
Sure.
And especially, I don't know about anybody else, because I have a consulting firm and a contractor at my doorstep almost every day.
Yes, sir.
So I thought I'd come back and say, hey, can we take a look at that? Then the other side of that is, what concerns me is, I'm gonna beat on Charlie for a second. But seeing that we don't have any long-range plan, we have not talked about where we're headed in the next 5, 10, 15 years. And so we're going to put 2 medical homes out there, and we really haven't talked as a board if that's really our priority or where the medical homes would go. And so I was uncomfortable that we have not had any board retreat, no sessions to really talk about what's on the horizon, okay? So, and then we look at going into the bond program, you would just think that we would get a firm in here to really do a program budget, help us program how to just put it all together, just to implement the whole process, the bond. And so that's kind of where I was with the situation.
Yes, sir. That makes sense.
Hey, Mr. Chair, if I could.
Yes, sir.
Update, and Ralph and I, we talked about this. Chuck serves on the executive committee. We met last week, working on the agenda for the 12th, which is next board meeting. We are going to be coming back because, I know, Amanda, we've had some questions about, we've got to have a 5-year plan, and we worked last year, obviously trying to get the bond thing passed, and now where we're going. And Robert's in the process of coming up with, we talked about some companies, so we're going to come back to the board fairly quickly. We also have officers nominations, and we got an election coming up, and we thought as that changes and that baton passes, that there'd be a group on board to start with that, go forward. So we've heard that very loud and clear, so you're right on, Ralph.
Okay. So, Ralph, let me ask you then if this is an appropriate way to sort of get answers to your questions. What I'd like staff to do is take us through, there's basically 4 components that we've talked about at the board level that would be recommendations to the Commissioners Court regarding proceeding with items in the bond campaign. Those are the 2 medical homes, the ambulatory surgery center, which I am naming incorrectly now. What's the new name of that? There you go. Patient Care Center. Old dogs just don't learn new tricks. The psych emergency center and the parking garage. And those were the things that we had sort of listed as being potential first projects. And just to recap for a moment how those projects came to be, there's been a lot of discussion about how long it's taken to really get things moving after the bond election. Part of that, as you all know, was we had a legislature that was running amok. We had no idea what may happen or may not happen regarding hospital funding. Once that was finished and we had a picture of that in May, then I think there was a lot more energy applied to trying to come up with at least an initial solution. Some of the parameters with that were, what is the cost of operations relative to these new capital projects? And are we in a position yet to spend the capital necessary to support those projects? Another question was, what can we do quickly? What can we get out of the ground? What can we show progress with? What really reflects some of the effort that the Blue Ribbon Committee, and Steve's not here today, but I mean, I can tell you the Blue Ribbon Committee, there was a lot of discussion about what do we do in the community and how do we make an effort in the community as soon as possible without necessarily being able to address all the on-campus needs, but really extending JPS's services within the community. And that's where the medical home, the two medical home ideas came from. So that's just a little history as to where we ended up the way we did, until the Commissioners Court bangs the gavel and says, this is what we're doing, then all these are still, I think, recommendations. But what I'd like staff to do is take each one of those elements and walk us through on a couple of levels. First of all, let's understand the architectural component as opposed to the construction component. If there are plans that we have done in the past, what is our effort to integrate those plans? Do we own those plans? Are they someone else's plans? What are the issues regarding competitive bidding? We want to understand kind of everything there is to know about that process so that it's clear for us that we've got a transparent, clear direction and that the committee is on board with understanding that we've planned that correctly. And we may interrupt and ask questions as we go, but if you'll start off, I think we can, we'll fill in gaps.
Okay, so if we start with the two regional medical homes.
Okay.
The thought on the architect on that, we do own those plans. Corrigan did the work for us originally. They were selected based off an RFQ, for the best qualifications for that. And so just because they've already done the work, they're familiar with the design, it is just more for us a financial reason that we looked at them, because we wouldn't have to pay somebody else all over again. And that's our prototype. When it comes to building that clinic, we would have to we'd have to issue an RFP like we do every single time, and we'd base our selection on best value, and we'd bring that back to the board as required, by policy. We'd be sitting right here in front of y'all again. And, whatever, we're here to serve, whatever the direction is on those regional medical homes, we are happy to do that.
And let me ask you a question on the architect component. Those plans are done relative to Northeast. That's
Yes,
the
sir.
model? So if those plans are done, kind of contrast for us what it would look like to start from scratch versus what it looks like in terms of what we would be able to either add on or change regarding the current plans. And because I think we need to understand if there's a major difference between those two, or if it's really just incremental in terms of new costs that would be necessary to support two new medical homes. Give us some detail on that, please.
Okay, but this is what I would say on that. The change primarily to our prototype that we already have is the behavioral health component would be expanded in the new medical home. And if y'all remember, and I know all of you weren't on the planning committee at the time, but when we brought this forward to start with the design, that was done purposely to where we could expand on either end of that building with the shape. We could go out either way. And it would be easy because we're always growing. So that was one of the main things we did with that design, was it was laid out to be easy access for renovation and additions to that. Dollar-wise, gosh, it would just be, a lot more money to pay somebody to start over. And the time. It's going to be a time component and a dollar component. And Lou, if you'd like to jump in, because Lou is working hard.
And Lou,
on
thank you. I
this.
know Lou's been working on this as well.
Sure. Currently, we're anticipating about a 40 to 45% in cost savings of design services. Is currently what we're anticipating by going with Corrigan again. Obviously, with when we're building on a new site, we still had to do civil, we still had to do structure, and we still had to do construction administration and closeout. But as far as the internal components and the guts of the building, all the programming and planning that went into it, we get those economies of scale. And so that's why we proposed that last time.
And JPS owns those plans, correct?
Well, there's there's some intellectual property, legal counsel there. From an engineer's standpoint, there was their thoughts on paper. However, we do have some rights and some opportunities to leverage those.
We would not have to go pay them to do it all over again.
Not to pay them to do it all over again. Again, we're anticipating about a 40 to 45% cost savings in overall design services.
Okay.
What's the dollar amount of that?
Well, for Northeast Medical Home, the total design expenses was around 900,000, so is that 380?
45% is about 380, 370.
And that's per medical.
Okay.
So multiply that, and it adds up pretty quick.
What's your comparison?
I understand that fully. But you gotta, some kind of way, then we've got to go back and take a look at ourselves, because I might have missed that meeting, I don't know, but I don't recall us when we, okay, let me back up. I know that I was one of those who continually asked that we make sure that when we built Northeast, that it addressed future. Okay, that because when we did Southeast, it was too small when we finished. Okay, but I don't recall us putting in minutes saying this would be the future prototype. This would be for all other medical homes. Okay, it might be. We might have voted that. So when you take a look out in the community and they see us now voting to use this for other facilities, what are we saying to those contractors? Did we go behind the scenes and now we're okaying this particular? I'm dealing with just what it looks like. And when you're talking to individuals out there in the community, well, now you just zapped us out because you've already made up your mind on what you're gonna do. So I don't know how we address that.
Yeah, it wouldn't, you said the word contractors. Contractors would still have
Well,
to go through the process
They're going
like
to do a
all
bid
of us,
process.
right?
I'm saying contract, but I'm talking about the whole process from the architect to the construction.
Okay.
But it really, if I hear what you're saying, Angie, and again, I don't remember whether it's a prototype. I know that building was designed. It does have, like I think you mentioned, it has the ability to be extended and enlarged. We don't even know where we don't even know where the next ones are going.
Right.
Correct.
But it sounds more of a financial question, Ralph. I don't agree with, I don't recall we said who owns plans, who didn't own the plans. I hear us saying is, if we're happy with Northeast, and it is the prototype, and it works for the staff, and we think it is, we still have that option on the table to utilize that one.
Yes, sir.
But if we go someplace else and buy a different piece of property, and we want to hire a new architect, and we don't want the efficiency of saving the 45%, we would have had to hire another architect to do this one out here on its own. We can still go do that once we decide where these next medical homes are going. I mean, I think right now we're caught up with, gee, we say 45%, but we don't know where, we're not designing, we're not changing the plans right now on that Northeast medical home in anticipation of where the next one's gonna be built. So everything's on hold right
Correct.
now. So the time to be asking these decisions is right now. It doesn't eliminate the fact that if we do, as a board, going to go out and hire another architect, we're not bound that architect is the only architect's gonna design everything for this institution, correct me, is that? So the options are on the table. I think the time to ask questions, Ralph, like this, they're good questions to ask at this point in time.
Let me ask, even if you are using the current architect's plans, we still have to pay them if we expand or if we do anything with it? You still have a cost there?
Yes, no question.
Yeah, okay. I just want to make sure. Yeah, okay. So you know, when we talk about the 45%, I'm thinking, well, you already got the plans now. Why do you need to pay again? But even though we have it,
But
we
there's a
still have to pay.
supervision. Yeah, no, you're right, Dorothy.
The architectural services also includes your engineering, your MEPs,
Yeah.
and those kind of things, which are, it's in the
Additional.
architect's scope, but another firm that the architect hires includes those into the plans.
I guess the question is, I don't think we're minimizing what we've done in northeastern county. Seems to be working, the building's great, nobody's, I mean, I'll ask the operational people, maybe there's issues I don't know about, but that seems to be
we got what we asked for. Now, we don't even know where we're gonna build next, who's gonna build it, and if we need to change architects, this board and planning committees, and those options are still on the table. And y'all haven't committed past what this board's approved.
That's
I think that's the point, yeah.
Let me say, and I'm not sitting here in disagreement of what we've done. I just want to be sure we got it clean.
Yeah. Get that blackboard clean and let's, so we
Yeah,
can decide where we're gonna go next.
Right, so,
Question, on the northeast campus, then, with the architecture plans that were had, was that a ground-up build, or was that a?
Ground
so-
up. It's-
So then that's a clean slate, wherever we decide to put it. Does that give the flexibility, if it's a building that we want to take over, would we need another architect to do that?
Well,
So
the-
if we decide to take over another piece of a clinic or something that was.
Another piece of
Roger
property.
was saying, the architecture, their agreement has all the engineering work, so, we would need to, we'll still do soils testing, so the foundation and the civil, like the size and the orientation of the lot, the parking, we've got to redo that. We had to redo the structure, and then,
When you say redo the structure, what does that
What does that mean?
it's, the foundation design. Just, the soil testing and the slab.
Geophysical and all
Concrete
that.
slab.
Yeah.
But the structural, design of the building itself, the roof and the walls and all, that's already done. It's only for the foundation.
Okay.
Thank you.
Okay.
When we, and Roger will remember this, when we finally decided to move forward with Northeast, I know it was discussed in planning and at the board level that we wanted it to be a prototype, at least conceptually, so that we would have something functional that we could replicate, knowing that there would be pluses and minuses and changes. I don't think it was necessarily amended action, but I think it was generally assumed that we would build ultimately that Northeast from the perspective of being able to replicate it. Is that right, Angie? Okay.
And if I can, Mr. Chairman, I think is also, in addition to what we built, it had to be operational functional, and we had to spend time in there. And obviously, I'm gonna check the operations on, if it's working the way the architects designed it, and yet it's working the right way we want it to functionally, then I think that's a component, just because it's a pretty building and all that's great, but it's gotta be functional not only for coming and going and convenience, it's gotta be functional for the operational use intended that goes on the building. I think today the clarification is, I don't think we're currently bound, Ralph, I'm not putting more, but we're not bound to the existing architect of the Northeast Medical Home if there's decisions made to go build additional ones somewhere else. We can use that group, but we're not legally bound to use that if we want to go design another medical home. Is that? Yeah, I mean, that's, y'all are the staff, so,
right,
yeah.
but if I hear staff, and I would hate we would not go that route, but I hear staff said the prudent way is to use the present architect
Oh, yeah.
Yeah,
based on cost. And, right,
Well,
so, hey, yeah.
I can speak not only as a contractor, but also a patient at the Northeast Clinic. It is a very efficient
True.
use, and number one, it's a very nice clinic. But as someone who sits in that waiting corridor and see a lot of people go through those doors, it is a very efficient use of space, and I think a fine model that could be either expanded or contracted, or however we needed to do it to whatever community it needs to be in. That base footprint is really a fantastic footprint. I have no idea about the operation. I guess I don't really care about that, but from a patient's side of view, it's very easy to identify if you're going to behavior, or if you're going to x-ray, if you're going to lab, or if you're going to dentistry. I think it's a great layout.
So does that clarify the position relative to the two clinics? Okay, then let's talk a little bit about the psych, this emergency psych center. And the question here is, when we initially started talking about this, there had been, you correct me if I'm wrong, there had been some discussion about a conceptual design that would allow us to begin looking at things like placement and traffic flow. It was not a contract to go build it.
No.
It was
No.
conceptual in nature to be able to give us a site look, location, access. Is that correct, Angie?
Yes, sir.
Okay.
Yes, sir. We were looking at, we know in the future we hope to build the behavioral health hospital, and where did it make the most sense to put the psych ED, because the 10th floor is not the optimal place
Right.
for it. And so we were looking at placement, what does it look like? That we would have to have an RFQ for an architect. We'd have to go out for that and bring that back to the planning committee, but that was, just such a big need that that's what we were looking at.
So, am I hearing you correctly, that once we get that component, which we had actually contracted for before the bond election came about, that is something we discussed a year ago?
Well, that patient care center, that's the one you're thinking about that we're.
I thought we had also discussed the other
Well,
one,
we
I'm sorry.
talked about the psych ED, but we haven't made we haven't come back to
Okay.
y'all with anything on that one.
Okay, all
Patient
right.
care center, we did.
Okay, so the psych ED is still, at this point in time, that's a project that once the board approves and the commissioners court approves the money, that we will go out for an RFQ for an architect.
Yes, sir.
Okay. Is that clear? Everybody good with that? All right, so let's talk about the ambulatory center then.
Okay. The new
The
patient care center.
center.
Yeah.
I'm
You
I'm
just keep
sorry.
changing
But
it.
we did come to y'all, and it has been probably last June that we came and talked about we went out for an RFQ. We had a short list of architects. We went through those architects. There was probably, I believe, a 7-member evaluation committee that included 4 executives and I think 3 people from my team. I believe that's correct. And we brought that forward. It was E4H was the architectural firm, and that was approved by the board. Now, we have not done anything, we haven't pushed forward with that. We're waiting for, more decisions. We need to know what to put in there. That's what we were looking at, the programming, what does need to go in there besides, the ambulatory surgery component, what makes the most sense. So that's the part we were currently wanting to look at.
So what's the scope as it is written today
Right.
for that contract?
The first phase, we just did the task order 1, and that is, the programming is what we were starting with.
Okay.
But
For the overall contract is the entire, programming, planning, and design, and each stage would be brought back
Back,
to the board
yes.
for
Okay.
decision to move forward. There's currently only feasibility studies, kind of some demographics,
Okay.
and that sort of thing at this point, and particularly after Commissioners Court, there hasn't been.
Stage informs the next stage, right?
Yes.
Correct.
And we bring that back to you at every stage.
At every stage,
Yes,
right?
sir.
Okay.
Yes, ma'am.
I have one question. When we were talking about the patient care center,
Yes, ma'am.
it was parking was included. What was the traffic flow? Is that the same contract?
Yes, ma'am. Yes, ma'am. That's
Okay,
it.
and so.
You're exactly right.
Because that was the one that we were, Zim was concerned about having enough parking,
Mm-hmm.
and you were gonna come back and provide us the best place to put it
That's
and all of
correct.
that. So
That's
that's
correct.
what you're working on now?
Yes, ma'am.
But it is a phased contract.
It is. With just a task order, and as we get approval, we'd move forward.
Okay, so that contract went through an RFQ. That was selected. And they are under contract. And when are you on hold right now? Or do you expect that to come forward to the planning committee with any recommendations regarding those phases?
Trent, we're working on that right now.
Okay,
I think by the time we meet again, we should have some more information for you.
okay.
So if that's okay?
So
We are
from-
actively working on it.
My question is it on hold or are y'all working on it?
We're working on it.
Okay, all right, so that was in process, right?
Okay, yeah.
Okay, so, parking garage. Tell me how that looks once we finally pull the trigger and say go.
Well, Lou, speak to that,
Lou?
because he loves parking.
I wouldn't say that. What the staff recommendation last month, the parking garage was included within the PEC and the behavioral health hospital. So all that was lumped into one component, because we didn't want to build a parking garage that wasn't going to coincide with whatever ended up going on with the hospital. So that RFQ is on hold, and will not move forward until approved. But the PEC, the parking garage, and the behavioral health hospital was the staff recommendation to move forward with an RFQ for architectural services.
So really no difference in what we have done on any other project?
No,
I mean,
sir.
it's preceded by an RFQ, the RFQ goes to committee, the committee makes recommendation to staff, staff comes back to planning, planning makes recommendation to the board, and the board awards contract, right?
Yes, sir.
Which has been the standard process.
Same thing we do on
I think,
all of
Trent,
those, right?
part of the, and maybe some of my confusion and maybe a little bit of the disconnect is, and maybe when you're talking about planning and strategic plan is, it seems like we've passed the bond issue. We know what we want, what needs to be as part of the physical buildings. Okay, we don't know what happens in each of those buildings, but we know we need the PCC, and we know that we need the parking garage, and we know that we need the behavioral, and we know that there's a tower involved somewhere. I just know from speaking to Commissioner Fickus, is it just seems like, well, we're gonna put this here. It seems like there's no plan, there's no master plan as to what, say, in 15 years, the bond issue has been expended. It's halfway paid for, but what does the future of the campus itself look like? And I think that might be where the disconnect is. I mean, we've seen some maps, and it makes absolute sense that this building should go right here. But what happens to the old building that's next to it, or the old building we might need to buy across the street, or whatever else?
Andy, does that exist, a master plan, a master campus plan?
Not in its totality.
Yeah. I think that's one thing we're gonna hear on the 17th. I mean, the Boca Powell master plan study, this board has seen approved years back, because many on this board went all the United States before we got in the bond package. So that original, to say there was never a master plan, there was a master plan approved by the board. I think it needs updating now.
Currently.
We didn't have $800 million, but yeah, it's time to update that master plan and decide what's gonna happen. I think that's where the Commissioners Court and this board, in collaboration, we didn't have the money, work together to get the money, and hopefully we'll work together to spend the money. So I think that's the next phase. And I think that's the piece that's missing.
And I think is going forward to our meeting on the 17th to tell the commissioners that, you know, a first step prior to hiring a program manager or to whatever else is we're going to have some consultants come down and say, this is really the way your campus should operate. I think that would go very far in assuring them that we're not just, we've got $800 million and we're just throwing buildings where they seem to fit.
PEC that they didn't know about. What do you mean?
I would agree with Roger, because one of my concerns is, again, is that we go into this meeting with the Commissioners Court, and they already have somewhat their thought process of what they envision taking place. But you've appointed us as a board to lead, but what are we gonna lead with? We don't have a package. And that's what really my concern is, you know, when we talk about program and construction and all, you know, it's Trent missed those items a second ago. I would hate really for us to go into that meeting saying these are our items, as opposed to, hey, this is our program. This is where we see this going, this going, this going. And especially when we talk about, and I said this before, all of the new trends and new things that are happening in the healthcare industry. We talk about the medical homes, and you got CVS, CVS, that's talking about doing their own clinics. I mean, that would impact where we put the medical homes, basically, you know. So I would just hope that we would have, I don't know, we can't fast track that, but we have something to say to them. Because what I don't want, what I'm hoping not to happen is, yeah, we're on camera, aren't we? Okay, but that we become just.
Mr. Brooks, turn it off.
Yeah. That I just don't want us to become the puppet. And that they are making decisions politically, but we're making decisions community-wise. And I think we just got to be careful of that. And I think somewhere we got to say, Commissioners Court, you appointed us, let us do that. Let us, you know, even if we don't have it going in, to say we are working to have that.
Well, I can tell you that from our discussions, that it was very clear to me that the Commissioners Court wanted to keep the board very integral in this process, and that they were going to listen to board input and rely on board input. when it came to final decisions. I still think there's questions about the details of how each component of this gets approved and when. I think that's still out there, but I've never had the feeling that the commissioners were in any way trying to supplant the board when it came to exactly what we're talking about. So to that end, Angie, I'm gonna put you on the spot here, and I won't hold you to it, even though you're on television, there's 1 million people watching. If we were to, at this point in time, try to wrap up a scope that sort of defined a campus master plan or a new plan that would encompass the phasing and everything you've heard today, how long would it take to put such a scope together, and what would we be expecting in terms of an RFQ? Because I would not be surprised if after this, we're not asked to prepare such a scope and be in a position to be ready to advise the board on recommending that. So what does that look like in your opinion?
Couple
And Bill,
hours.
Lou, Bill or Lou weigh
No,
in too,
you know,
I mean, not just you
seriously,
on the spot.
Mr. Chairman, if you told us when you wanted it, we would have something. But truly, if, we've never done a bond package, obviously, nobody at this side of the table has. So there probably is an opportunity for us to go out and find as Roger said, a consultant to help us put that together.
Okay.
You know, I want to have a complete plan for y'all,
Sure.
something to look at that you can approve, and I know Lou does as well.
Okay.
But it's certainly, we're not going to be able to have it together by the 17th.
No, and I wasn't implying that. More along the lines of if it comes out on the 17th, that the hospital district should pursue such a course.
Right. I'm
How would it-
thinking
how would it look?
90 days, 90,
Wow.
90, maybe
That's-
120.
that's fast.
I
That's-
think we
that's
can
very fast.
start, get something together for y'all to look at. It wouldn't have all the financials, everything. It wouldn't be the
Yeah.
whole big package. Is that what you're
But
looking for?
before we could use that to go out there and essentially start construction of a project, we're talking longer than 90 days.
Well, yeah, I thought you just wanted our little program of what we're doing.
Yeah.
What the RFQ would look like.
Yeah.
That's what I was under.
Okay, so it's a major
And
effort.
if you're gonna do a brand new RFQ, and I go back to the previous consultants, which we paid a fortune
Yeah.
to, and ask them to update, there's two separate entities here.
Well, and
The previous boards that committed to master plans, we can name all those companies, there's been, the commissioners know exactly how many dollars were spent. We gonna go back there and bring that forward, or we gonna throw all that and start over? I think that's some of those directions we're gonna need some input.
it's a
on.
very legitimate question, and to what extent we utilize existing plans, and I think staff will be relied heavily on this. The board and I think the Commissioners Court both will say, okay, Robert and staff, Boca Powell was X, Blue Cottage was Y.
Yeah.
It's been 8, 9 years. From a staff perspective, how much of this is usable versus how much is not? Because there may be, even then, a more efficient path rather than just starting over. I can't imagine that we would start over. But from a timing perspective, I'm still trying to keep us where we all talked about wanting to be, and that's, not go down the road 10 years before we have something under construction. So I think that's something staff should probably prepare for, is discussion about what components are usable and should be updated, what components should we throw out and start over on. But I think ultimately it's going to come up to you all to tell us what that scope needs to look like, and this group's then going to have to make a decision on what that RFQ process looks like and the timing and cost and everything else, right?
Yes, sir.
Yeah, because, as I'm sitting there thinking, the Boca Pile and the Blue Cottage, I can't remember if we gave them the charge to look at this because we're looking at bond, as opposed to looking at this, to look at it just a master plan.
I think theirs was a master plan, if I can recall.
Right.
There's a lot of work done before I came on board, but I think the real question is healthcare, you brought it up, is healthcare changed so much that their master plan is an antiquated way of looking at things? It was a master plan, and when you look at what was spent, it was a phenomenal amount of dollars spent, and a lot of hours went into it. I'm just saying is, we probably need to see, is there something there that could be used? If not, if we have to go out for brand new, you gotta remember something, we don't have $800 million sitting in the bank.
Right.
These are bond deals, and we're not
Right.
paying interest. I mean, I think the issue is we gotta get the services and get these facilities so we can better serve our patients. I think that's the reason behind it. I think the question as to where it goes and how it goes and those costs,
do we go back and look, like you say, Trent, Blue Cottage? My gosh, they were in here for, what, 2 years? I bet they were
Long
here
time.
2 years. You've been, you're a chair, there's a chair sitting over. There's been 2 or 3 chairs. We went through a lot of discussions, flew all over the country,
Yeah.
looking at their hospitals and looking at things. A lot of work was spent. If we need to put that back over here, start over, I'm certainly for that. But I think somebody's gonna ask us, there was a lot of dollars and times expended in those deals, so.
If you take all of those, the Blue Cottage, and then you took the Blue Ribbon Panel, there are 4 or 5 components of that followed through.
Right.
I mean, the master plan followed through, and I think if you look at that, all I'm saying is that once you take those out, what will that campus look like?
Right.
You've already done the oncology piece. It's already plopped somewhere else. And now we're saying on the behavior, which I'm not sure if it's one major here or where,
Right.
but that was something that we'd have to discuss. But you're talking about the patient care center was in all 3 of them.
That's right.
And Trent, you know,
And
yeah,
the CHCs were there. So
Wait,
you're
no, it's the
talking
patient
about
care
taking
center.
those pieces and saying, where would they fit? And what is the timeline of something like that? And you did some cost estimates and operational, you ain't gonna put them up, but a couple of them the first year anyway.
in fact, Trent, if you recall, you served on the Citizens Blue Ribbon Committee, and one of their charges they looked at what master plans had been done. They had to know what kind of dollars to go out for. They just didn't pull the money out of the air. So there was a framework of some master plan, or we'd have never got through the Citizens Blue Ribbon Committee. They wouldn't know what they needed. So
And
I think
the
we're
only
headed
exception of that was even the Citizens Blue Ribbon Committee had no inkling where the 2 clinics might go.
where they go. That's right. Now we're down to where's things go.
I find it interesting because Blue Cottage and Broadus did the master plans. We get on bus and planes and fly around the country. We left thinking one thing, we came back, Dorothy wanted an ambulatory center.
That's right. And Dorothy's gonna get one. And let me make one statement for those new to the board. Boca Powell, yes, Don Powell out of Dallas, Texas, I don't know him. He's the wealthy Powell. I have no relationship with Don Powell and Boca Powell. So I want y'all to know that, so. anyway.
Okay, so, committee, does that put you all in a good position of knowing where we stand and where we are relative to preparation for the 17th?
I think it's a good exercise, Trent, I really do.
All right.
Ralph, is a good question.
Anybody have any more questions? You good, Chuck?
Good. Good.
I'm good.
Okay.
Sorry, Angie, you got a lot of stuff to do.
Anything else from staff that you'd planned on telling us that you hadn't told us?
No, sir, we're good.
Good deal.
We appreciate it very much. We have to be led through this step by step because it's complex. It's got a lot of money, and a lot of time, and there's a lot of eyes right. All of us do. So I
So
appreciate
the
it.
meeting on the 17th is downtown?
Yes,
Yes,
Yes.
that's my understanding.
it is. It's posted, yeah, it's downtown.
All right, is there anything else to come before the committee then today? I'm so happy I'm gonna get to watch my son's football game. 100 degrees outside. All right, then hearing no further business, we'll stand adjourned at 4:13 PM. Thank you all.